Thank you very much, Kira, and it is a privilege to facilitate this new thematic session after so many brilliant presentation. Please stay with us for the next hour on this thematic session of shifting power to the front line, strengthening local leadership to prevent child recruitment and GBV in humanitarian context. So thank you for the slide. And may I ask to move to the next slide just to give you a bit of content about who you can find in this slide. So this session is brilliantly prepared and coming to you from Right to Play, Plan International, but we are co-facilitating three wonderful presentations coming from the Dallaire Institute, from the Global Refugee Youth Network, and from the International Association School of Social Work. So, but now let's go to see who are the protagonists for this session that we can move to the next slides and you can see their wonderful smile with me spotlighted. So I am Domenico Di Nuzzo and I am the Global Child Protection Psychosocial Support Lead for Right to Play. My motto is try to be a rainbow in someone's cloud, and I would like to hand over to my brilliant co-facilitator. Pasantali?
Thank you, Dom, so much for this interesting. Yes, you can hear me now? Yeah, I'm here.
Yeah.
So thank you, Dom, for this interesting introduction. And it's nice to have you all here in our meeting today. I'm Pasant, I'm Protection Inclusion Advisor in Plan International Egypt and co-facilitating with the amazing Dom today. And my quote is always be sun. It means it will rise every day. Thank you. And over to our lovely panelists. Thank you.
Thank you, Pasant Ali. Lana, may I ask you to introduce yourself?
Yes, thank you. Thank you, Dom, and thank you, Pasant. Hello, everyone. My name is Lana Houssami. I'm the Programs Manager at Insane Charity Organization. It's great to be here. And my motto is just keep swimming from Finding Nemo.
I love that. So, Anastasiya.
Hi, everyone. My name is Anastasiya Romanska. I'm the Community Engagement Advisor at the Dallaire Institute for Children, Peace and Security, located in Halifax, Canada. I'm currently located in Toronto, and I shared the quote from the Dallaire Institute, which is, "Peace is possible, violence is preventable, and children must be at the heart of the solutions." Thank you.
That's such an inspirational quote. Thank you, Anastasiya. And over to Oricia.
Thank you. Hello, everyone. My name is Oricia Ngenyibungi. I'm the Policy Research and Inclusion Lead at the Global Refugee Youth Network. And my motto is be kind. Thank you.
Thank you, Oricia. And it's something that we really need to be kind to each other, particularly in this difficult context. And I would hand over now to Pasant Ali for the next expertise.
Thank you, Dom, and hello again, everyone. And thank you for being with us today in our thematic session, Shifting Power to the Frontline, Strengthening Local Partnership and prevent child recruitment and GBV in humanitarian context. We are absolutely thrilled to have you today. So this is your moment to jump in and kicking things off. And we have a quick interactive icebreaker using Mentimeters. We have got three powerful questions lined up for you. This is your space to reflect, share, and shape the energy of this session. So please, if you can head over to menti.com, the link is in the chat, and also you can use the QR code. And let's start.
You will find in the Menti link also some of the questions that will feed the conversation. Ooh.
Yes. Okay. Interesting. So there's so many interesting words that's coming up. Interesting. So our first question is about why it's important to pay attention to the role of local practitioners as knowledge creators. And we have some inspiring and lovely answers for better acceptability to improve resilience. They know best, they are expert because they have so much rich knowledge to share, democratizing knowledge, they're the right thing to do. Innovation from the ground up, local practitioner to develop creative adaptive solution, the outstanding may overlook, recognizing them as knowledge creator highlights grassroots innovative often amazing, more equal partnership. They can work areas we wouldn't be accepted. Interesting. They often trust in the community, can support in the understanding better the context. Interesting and very inspiring. Okay, so let's move to the next question. Let's see more how we can shape our session about shifting power to the community. So our question, why are women powerful actors when it comes to child protection and peace building? Let's see, what do you think about it? Okay. Women in peaceful actor. Why do we need to ask? They are half the population. Yes, amazing. Because women are often the best advocates for children. Okay, interesting. They are the most affected when calamities happen. Yes. Okay, interesting. Yes. Women know how communities can help take care of each other. They are 50% member of the communities and should automatically be included. Yeah, so all agree that women are half of the communities. Community trust and influence. Women frequently hold informal leadership roles in the community through schools, health service, religious setting, and local network. Amazing. They are often disproportionately affected, yes. Because women experience may be the most affected by violence, women are often the caretaker of their own communities. Women are powerful actors in all spaces, especially in child protection and peace building. Amazing answers, yes. Okay, that's amazing, and I think it will inspire our panelists while they are presenting their journey and their stories today. So here is more answers to come. Women often already have groups that they are part of which support communities and benefit of existing structure. Amazing and so inspiring. Thank you so much. Let's move to the another question. So our question here is, what are the top 3 challenges for you in working with refugee women, young women-led organization and refugee women, young women leaders? What do you think the challenges we may face if we are working with, okay, young women-led organization and young women leaders funding, access, okay. Short program cycle, interesting. Yes, actually, yes. Lack of representation. Short-term funding is challenging, especially now, yes. Trust. Okay. Lack of knowledge. High transactional cost. Funding, gender dynamics, risk appetite of the, okay. Okay, interesting. That's super interesting. And I think it shaped our discussion in this session, how we can, how shifting power to the communities may be affected and challenging, especially if we are talking about women and young women. So interesting. Yes, inspiring, interesting. That's great. Okay, thank you so much for jumping in, and it's so inspiring answers. The answers are already showing while we are talking, and let's carry that energy into the rest of the session. And over to you, Dom. Let's see our penalties, what you will say. Thank you.
Thank you, Pasant Ali, and thank you to all the responders. So, I'm very much happy to see that there are a lot of food for thoughts coming from the Mentimeters. And luckily, I will not be the one trying to answer your question, but we have a wonderful trio of wonderful panelists here that I would like to invite forward. So this session will be mostly a talk. I would say a presentation that will be a more of an open dialogue where we hope that you can participate definitely with your questions in the chat. There will be a moment for Q&A. But I would like to put the accent to this session on the three specific experience and models that Anastasiya, Oricia, and Lana will present to us. So then may I ask as a first question, maybe we can start from Anastasiya. Shall we look at the different contexts where you operated? So give us a bit of a frame of your experience.
Yes, thank you so much, Dom, and thank you everyone who joined this wonderful panel. I'm going to talk a little bit about the context in South Sudan to start off. This is where the activity that I'll be talking about takes place. So while we still work there right now, the Dallaire Institute did have a project there from June 1st, 2021 to April 30th, 2022. And as I'm sure a lot of you know, the ongoing armed conflict continues to expose children to grave violations in South Sudan. So, killing and maiming, the denial of humanitarian aid, and specifically the recruitment and use of children. So South Sudan actually has one of the highest rates of child recruitment globally. And you might be wondering why I'm saying the recruitment and use of children rather than, a more common term, child soldier. And I do want to quickly mention that the Dallaire Institute uses the term children recruited and used because we want to shift that perspective from children who are recruited and used aren't only used directly in hostilities. So children could be used for roles of cooking or spies or messengers. They're not always directly involved in the hostilities. And we find that term child soldier kind of brings up those perspectives. So just a quick note on that. And when we look at gender dynamics, women have historically been excluded from formal peace and security spaces. And I love that someone responded to the Menti saying, well, women are 50% of the population. Of course, we should include them, obviously. And unfortunately, that's just not the case. Women have historically been not allowed to sit at the table with the security sector or, police or government actors. And it's really unfortunate because that also just builds on that mistrust. And we saw that when we worked on this project. We saw a deep mistrust between law enforcement and women-led civil society organizations. And this really hindered the collaborative efforts and this hindered prevention efforts because while both the women-led CSOs and law enforcement were working towards, preventing recruitment and use, unfortunately, without that collaboration, a lot of the efforts fell short. So as an institute, we really identified that this specific context required kind of a context-aware and community-driven approach, and we wanted it to be rooted in local leadership and trust. So that's a bit of an overview, and I'll talk a little more about the model later on, but I'll pass it on. Thank you.
Thank you, Anastasiya. Yeah, there are a lot of questions that already come out, but I'm sure we will navigate that later. So then can I hand over maybe to Lana to explore the context in Northwest Syria?
Yeah, thank you, Dom, and thank you, Anastasiya. Hello, everyone. So I'll be talking about the context in Northwest Syria. Of course, at the time of the research, Northwest Syria was and Syria as a whole was not liberated yet. So it was considered a complex emergency. So the research and the online community advisory board was facilitated while Northwest Syria was still considered a complex emergency. And complex emergencies are characterized as strained institutions. And for example, Northwest Syria in 2022, only 422 out of 624 healthcare facilities were functioning. There were also so many mass displacement, like 2.8 million people were displaced. Of course, those are like the official numbers, and difficulties with access. So many institutions and so many organizations were having so much trouble with access due to security reasons and other things. The UN Security Council had adopted resolution to extend life-saving aid deliveries into Northwest Syria from Turkey.
Can we look a bit to the next slide
Yes,
and
please.
some testimony, Lana?
Yes, please. Thank you. So in complex emergencies, sometimes local practitioners are seen as people in need of education instead of creators of knowledge and contributors into its advancement. And in response, the research study was exploring practitioners' perspectives on good social work practices in Northwest Syria during the complex emergency. And we have even like a quote from one of the community advisory board member. So like what they said is showing the role and impact of social workers in Northwest Syria and benefiting from colleagues' experiences. And I would say like this is actually a great example because local practitioners, especially over the years, they have gained so much experience. They are locals, they are from the community, and also they went through so many trainings and have worked in different contexts through the whole thing. Thank you.
Thank you, Lana. And now, after experiencing like the context in South Sudan and the context in Northwest Syria, I would like to invite the participants of this session to look more at the global perspective. So, Oricia, can you present us a bit of your context?
Yes, sure. Thank you. So the Global Refugee Youth Network worked with UNHCR to design this guidance for UNHCR staff and other humanitarian and development practitioners who are involved in GBV prevention and response, including refugee young women leaders working with adolescent girls and girl-led groups. So it is a global guidance that's targeting UNHCR staff who design and implement partnerships and programming to prevent and respond to GBV in refugee context. It also targets refugee young women leaders who lead or are part of refugee young women-led organizations and who work with adolescent girls and girl-led groups in refugee communities, and finally, humanitarian and development actors. In terms of the aim of this guidance, the aim of this guidance is just to strengthen the prevention and response of gender-based violence in refugee communities, and by doing this, empowering refugee young women leaders and adolescent girls to form or work with established girl-led groups.
Thank you. Thank you, Oricia. Yeah.
Yeah, thank you.
It's thank you, and also thank you for the wonderful slide that really answer key questions about the questions about where, who, what, who help us for this global guidance that it will be published soon, right? So this is a sneak peek. So. And I would then move to the next questions. And again, I would like to look at all the three of you, if you can give us a brief presentation of the practice of the model that you applied through localization in order to strengthen the community, the local and the national CP actors in leadership and advancing the localization. Because in this from South Sudan and from the global, there has been three different examples that we could highlight. Maybe Anastasiya, could you start with your description of the model?
For sure, thank you. So our model, our project was called Building Bridges for Prevention. And the idea behind it was to train 45 women-led civil society organizations. And then these 45 CSOs created what is now called the Women's National Network, or WNN. This project was funded by the Fund for Innovation and Transformation. And we conducted workshops and roundtables bringing together the trained CSO members and key security sector stakeholders and government ministries. So it was sometimes, you know, one of the first times that these women-led CSOs had a chance to join with the security sector or with the government and have these important discussions. So after those concluded, we also hosted community dialogues where the civil society organizations brought together youth, women leaders, traditional authorities from their communities to have these conversations. And I can talk a little bit about why this approach really worked. And it's a variety of factors, but a really important one is that it addressed the gender dimensions of child recruitment and use and conflict-related sexual violence. You know, CRSV isn't often spoken about in a lot of the places where we work, and it is a very sensitive subject. So creating these safe spaces for these conversations and talking about how girls and boys might have different experiences when they are recruited and used was very, very important to the community. And we also built confidence and skills for these women. You know, it wasn't just about providing safe spaces, but it was also providing kind of the skills and the knowledge and the foundation where these women had, you know, the same vocabulary to talk about legal frameworks and to talk about recruitment and use in more formal security institutional settings. And finally, the scalability. So we found that it was really effective in kind of a low capacity and conflict affected region to the point where now we are scaling this model to work in other countries as well, where we're working with civil society organizations, not just women, but youth also, and then doing, you know, technical meetings and dialogues to further that engagement. And if we can quickly go to the next slide, I just have a few key stats. And obviously there's a lot, but the three I want to highlight is the knowledge and awareness of the Vancouver Principles. The Vancouver Principles are for preventing the recruitment and use of children, and specifically number 11, which is the women's role in prevention. So the knowledge of this increased from 26% to 95%, which was one, a huge jump, but also, you know, nearly all of the women-led CSOs showed this knowledge and awareness at the end of our project. The organization's prioritizing prevention increased from 30% to 74%. And this last one I find very interesting, that women-led CSOs who demonstrated skills that promote prevention of recruitment and use in CRSV increased from 0% at baseline to 56%. And obviously there's still room for growth, but when we look at the baseline of no women-led CSOs demonstrating these skills to more than half, that was, you know, something that we were very proud of and something that we wanted to continue growing. Thank you.
Thank you, Anastasiya. And also, I see that in the chat, some great questions are starting to arrive. But in the meantime, I will pass the same question to you, Lana. So if you can tell us about the model, the Community Advisory Board, how it works, what is the phases.
Yeah, thank you. So the online community advisory board, like basically there were 4 phases to it. The first one was preparing for the community advisory board, finalizing, like finishing the security assessment and ethical approval, and engaging 2 Syrian peer researchers, recruiting 13 community advisory board members. 6 of them were Syrians and 7 were international. The second phase was doing the pilot study with the Community Advisory Board. And in that phase, we conducted 7 interviews in the pilot study. 4 of them were with international practitioners, and 3 of them were with Syrian local practitioners. And 10 Community Advisory Board members participated in an online feedback survey. 5 of them were English speakers, and 5 of them were Arabic speakers. And of course, there was reviewing and incorporating their feedback. And in third phase, when we conducted the interviews, we did 22 interviews. 2 of those interviews were with international practitioners, and 20 of them were with Syrian practitioners. And then at the last phase, which was the fourth phase, we did a follow-up study with the Community Advisory Board by creating a final report draft in Arabic and in English, so it would be easy for both practitioners, Syrians and international. And also 5 of the Community Advisory Board members participated in an online follow-up survey. 2 of them were Arabic and 3 of them were in English. And I would like to also say that during phase 2, 3, and 4, there was translation and also ongoing analyzing of the data that we're receiving from the different practitioners. Thank you.
Thank you, Lana. And then, like Oricia, can also present to us. Can you present to us how the role and empowering the young women to step into the leadership? So, what came out from your research and model of?
Yeah, thank you so much. So what came out of this model is the fact that we need to invest in young women as leaders, and especially young refugee women, because empowering young women to step into their leadership is an untapped opportunity to address gender-based violence, including identifying, forming, and facilitating girl-led groups as a way to prevent and respond to GBV. We held consultations with refugee young women-led organizations in 7 different countries. We administered a global survey. We also had literature reviews. And finally, what we did is we gathered experience from other refugee youth-led organizations such as Green, and this informed the guidance that we have. I would say the best way to connect with adolescent girls and girl-led groups and young women is to engage directly with them and with refugee young women leaders in communities, either by partnering with them and young women directly. And this also comes to answer one of the questions in the Mentimeter, the 4 things that people highlighted, which is access, funding, representation, and trust, which is something that these guidelines tries to do. Thank you.
Thank you all. And now, since we are going deeper and deeper in the analysis, we are talking about 3 different types of frontliners. So we have women refugee-led organizations, we have local, national social workers, so the advisory board. So could you present as the role of the frontliners, the practitioners at the different phase that they played in the humanitarian action? So maybe Anastasiya, if you like, maybe we could start again with you. So.
For sure, thank you. And I do see some of the questions coming in the chat. Thank you so much for putting those in there, and hopefully I'll answer some of them through. And if not, maybe we can talk about it at the end. But when we look at community members as frontline leaders, they played some key roles across all phases because this project was really focused on them. And they were champions for children, peace, and security. So women-led CSOs raised awareness of child recruitment and use in CRSV. They did this through, 1, the community dialogues, and then post-community dialogues just in their communities and then in their works as well. So this included something like legal education during the community dialogues, where after the training where, they spent hours discussing legal frameworks and laws that were relevant to them and the areas where they lived. They then went on and shared this with their communities through community dialogues and sparked those conversations as well. They also brought forward practical solutions. So something as simple as finding the right path for birth certificate verification for recruitment of people was something that was brought up, multiple times. And then they found a way to actually integrate that process in a way that worked better for their community. So then we look at being bridge builders. And this really is what it came down to, where towards the end of the project, we saw these women serving kind of a role of trusted intermediary between community and between the security sector. These women were already leaders in their communities. They already, were trusted. but now they served as a bridge between the community and the security sector where that, fear and mistrust was. So sorry, I'm looking at the questions coming in, but when we're talking about which skills did they gain, I want to stray away from saying that they didn't have them before the intervention, right? I don't want to say that. A lot of times they did have these skills and we built upon them, or, we discussed as a group ways to enhance them. But we're talking about things like monitoring and reporting the grave violations, monitoring and reporting recruitment and use, and looking at very specific like context indicators for early warning to early action. We're talking about facilitation skills because the women did go on and co-facilitate these community dialogues. So learning kind of those mediation and co-facilitation skills to have productive dialogues. And then things like networking and real local leadership of working together as a part of this women's network rather than, just within their civil society organizations and working together to advocate and spread these messages. Thank you. I'm just conscious of time for now.
Thank you, Anastasiya. It's brilliant to see like this experience, how the women-led organization could work with the security actors, fostering trust, strengthening the policy influence. All of this is extremely inspirational, and you see that there are tons of questions coming in the chat. But in the meantime, may I also ask to Lana about the role of your local practitioners in the community advisory board?
Okay, so the role of the local practitioners are actually quite important source of information, especially when it comes to like effective local approaches that may be key to protecting children in complex emergencies, and that would include preventing recruitment and SGBV. The local practitioners are also like key to creating knowledge through evaluating the emergency-driven methodologies and learning practices for inclusivity, and also the effectiveness and accuracy. The online community advisory board, they really helped us gather the practitioners' perspectives on these issues, even in difficult circumstances. So yeah.
Yeah, thank you, Lana. What for me is extremely great is because through this community advisory role and your experience, you gave us a strong model about the local practitioners can be engaged also like in research program and policy development. So in order to improve in different types of responses that we are usually to see. And this is extremely brilliant in linking local expertise with global knowledge as well. So, and then Oricia, can we see about the role of adolescent girls, of women, refugee women in your case?
Yeah, thank you. So the guidance will have 4 sections, and the second section, which is on your screen now, highlights the principles and approaches to partnering with young women leaders to work with refugee, adolescent girls to prevent and respond to GBV. Based on our conversations with these refugee young women leaders, these are the principles and approaches that were mentioned throughout the conversations that we had with them. And these are principles that we encourage practitioners, either in humanitarian and development sectors, to use while working with adolescent girls and refugee young women leaders. So as it is, I'm going to just emphasize more on the approaches. We have advised 5 approaches, and one of them is form genuine partnerships. With this agenda of localization, if you want to reach refugee adolescent girls, and especially the most marginalized one, it is better to work with a refugee young women leader because one, she knows where to find them, she knows the context, she knows the areas, she knows her communities. So if you're able to form a genuine partnership and transfer and shift power, just as the title session says, to the front line, and the front line here is the young woman leader, then we can be able to prevent and respond to GBV in refugee contexts. Yeah, so my main takeaway from this section is to form genuine partnerships with refugee young women leaders in order to reach adolescent girls.
Definitely. Yeah, thank you, because it's brilliant to see like how in this approach, in this model to prevent and response to GBV, we see really like that not only young refugee women, but also like adolescent girls are really at the service in a peer service provision. So really like supporting each other in mutual support, which is there are a lot of a lot of good lessons learned that we could take from your experience. And now, for the next questions, I would like to go deeper in the cases of each one of you, maybe starting exactly from you, Oricia, and the conversation. So, because could you highlight for us how these approaches could contribute to filling the gap in the so why are they efficient? Why are they effective? So these are the questions that accompany a lot of sessions in London meetings, and I would like maybe to explore this with you, how they are, the value for money for localization and why they are efficient and effective.
Yeah, thank you. So I'd say there is huge potential in partnering with young women leaders and refugee youth-led organizations with young women in their leadership. I cannot emphasize more about having young women in leadership and working with young women leaders, because they are led by and focused by young women, and they are continuously present in the community, and they understand the community in a way that outsiders cannot. So the gap in refugee young women leaders is very visible, even amongst the youthful and informal sectors. We see how cultural norms and gender discrimination disempower young women. So therefore, if you want to localize effort, if you want to localize services, if you want to localize the prevention and response of GBV, it is better to work with young women in communities in order to prevent and respond to GBV. We can see that even though young women are active in the community or within refugee youth-led organizations, young women and adolescent girls are often not recognized as leaders. They may not even recognize themselves as leaders. Therefore, male leadership even often controls the resources and programmings, and they often don't see issues such as GBV as priorities. That is why we emphasize that, young women and adolescent girls to lead this, so that adolescent girls can feel safe, and be able to, prevent this harmful thing that affects women. Thank you.
Thank you, Risha. And then I would like to move, remaining exactly on the efficiency and effectiveness. Maybe Lana, the question for you is, we know that localization is actually right. But can you show us through your experience why a localized approach is effective and I would say convenient, practical in this global context of shrinking fund for humanitarian aid?
Yeah, thank you. I mean, I would say this question is like the most rising question of all times, no matter different meetings. It's very technical, but it's something that all of us are suffering from on different levels. I would say like the ethical and practical considerations. One of the things, of course, that really helps is that the local practitioners are already there, so they're already present in the location. And also including the local practitioners in the community advisory board really helped us on different things, increasing the relevance of the study to the Syrian culture and context, promoting a more beneficial study for practitioners, increasing the opportunities for local practitioners to take ownership of the knowledge and developing the development and learning. And also collaborating with the local social work practitioners is really quite important for the long-term strategy, because they are often already present, as I have mentioned earlier. They may have years of significant experience and also knowledge, which includes the most effective ways to learn from and with their communities. And of course, this is a really big discussion, but it really helped us to have those community advisory board on the ground.
I'm pretty sure that we will have more time in the Q&A to explore more, but then, Anastasiya, I always call you to answer first this time. So for you, like the last question is, how also this approach will support the shifting the power to the community?
Thank you. And no worries. I like listening to everyone else as well. So shifting power to the community, and I hope that, you know, from my past slides, I also kind of emphasized why this specific activity was focused on shifting the power to these women-led CSOs. And I can give you, you know, 10 more different statistics on, you know, improvement. But I really wanted to share a quote from one of our participants, Mary, who's a community chief. And it really resonated with our team. But she said, "This project gave me an opportunity to be part of the decision-making process among the men and to be a voice for the voiceless in protecting children from violence. The women from our committee are now managing to reduce the risk of children's recruitment with armed groups, as women are essential in the prevention of violence against children." And, you know, this quote, there's a lot of parts that we can dissect, but I think what's really important is that through, you know, these training and then these action planning, these women really created the strategies that they wanted themselves. You know, we didn't tell them how to engage with the security sector, how to engage with local police, or how to engage with their communities. We asked them, like, what do you think will be relevant for your community? What do you think the best next steps are? So then through this network, they had the collaboration between the CSOs and the collaboration between different, you know, women, and together they created action plans for, you know, the community dialogues they wanted to host, or maybe local education sessions with schools or communities. And what's important is that it wasn't just them advocating for what was relevant for their organization or for themselves, but it was them advocating for their communities. And that's when Mary says to be the voice for the voiceless. And I think that really kind of encompasses what we're trying to do here. And someone asked, what sustainable strategies have we identified? And I want to emphasize that right now, there's really hasn't been, you know, a warning system for recruitment and use specifically. And since 2019, that's what the Dallaire Institute has been trying to put in place. And it's about, you know, understanding the indicators of child recruitment and use in communities. And that's going to vary greatly depending on where we're working and depending on the community, the region, the conflict. But understanding what are the warning signs, and then understanding what early action steps can we take to ideally prevent this before it happens. And it starts with you know, projects like this one, where we engage CSOs who are on the ground, who understand the context and who have that trust with communities. And I want everyone to kind of think about it in like the cyclical nature of, we get that knowledge from communities that is shared to the CSOs, where the CSOs can then, oh, sorry, there was an echo, where the CSOs can then share with the security sector, and ideally that's going to influence how the security sector responds to these communities. So I know I can talk a lot more about early warning to early action, but that's a whole other thing. So I'll leave it at that. And then I know we have a Q&A or something afterwards as well.
Yeah, thank you, Anastasiya. So definitely, I think that the testimony and the sentences, the sentence of Mary will stay with us, exactly, like being a voice for the voiceless. But then I finish here my part in asking all of you questions, and I leave to Pasant Ali for the next part.
Thank you, Dom. And wow, what a powerful journey we have been on today, and hearing to these inspiring stories and example on the ground about how shifting power to the community. However, so let's take a moment to reflect and key takeaway from each of our incredible panelists today, because there is ideas we want to carry forward, especially as many of you start to asking about how and when and how and when and why we can do this part of shifting power to the community and localization. Lana today highlighted to us that local practitioners aren't just participants, they are co-creators of knowledge. Their voice should shape every step of the research process, while Anastasiya, when women-led organizations partner with security actors, they become powerful protectors of children and peace builders in their community. Oricia showing us real change happen when we build genuine partnership with refugee young women, centering their life experience and shifting power to them. This amazing takeaway to take with us today after our session. And now, before we open floor for your question, quick pulse check. We have got a quick Zoom poll. We want to know where your organization stands on localization and whether these models could work in your context. So please feel free to start using the poll. The first question is about where is your organization advancing localization? Localization means how we can shifting power to the community through strengthening community CP actors, strengthening local CP actors, strengthening national CP actor, and not advancing localization yet. We didn't start your organization or where we are working, then start working in localization. So let's see. And question number 2, do you think these localized models could be adapted for your context or not? Thank you all for taking part in that quick poll. Your response gave us a real-time snapshots of where we are as a community. Let's take a look first for about an open floor for your question. So please free, if you feel, if you have any question, please drop it in the chat. And we already have like 2 questions already mentioned in the chat box. So the first question to you, Lana. One of the attendees just highlighted how in the face of ongoing crisis and conflict, how we can shift from response model driven by central actor to solution led by those on the front lines. How do we place local partnership in the heart of the offer, at the heart of efforts to project children from recruitment, GBV, imagining child protection as more just sustainable and context driven? So Lana, of any of our panelists, if you want to jump in and answer this question, please feel free.
I think there are like multiple questions in that question, but I'll try to answer as much as possible. And then if I forget something, please let me know, because I do feel there were different things. Okay, so I'll speak like from different hats, from the research hat and also from this hat that I'm currently, because I also work with a local organization right now. So definitely like having a local actors really like helps. Localization, you get a lot of information from them. They are a great resource of information. You're also empowering them. When it comes to the funding cuts that everyone is suffering from, as I said, they are already present on the ground. But also like when we have, and I think a lot of people also mentioned this, like through partnerships as well. When you build partnerships with the local organizations or the local actors that really also you are like supporting the community. You have people who are experienced, who are working in the community. And at the same time, like you are not spending as much money as it is. And there are, as we all know, there are different trainings, there are different approaches that everyone like takes based on their program or project that they're implementing. I feel that I maybe answered some things. If I missed something or you want someone else to answer, just let me know.
Thank you so much, Lana. Thank you. Just give a quick example how we can, like, what approaches or what methodologies we can use to start to work from down to top, not top to down, to give the lead to the frontliners and shift power to the communities. However, if any of the panelists have another opinion to add to this question or not, if you're not, you can move to the other question. Okay, we have another question for you, Anna. What were the skills that promotes intervention of recruitment CRSV that WLOs or women-led organization didn't have before the intervention and the gains for participation. What do you think, Anna? Anastasiya.
Thank you. So I tried to answer this earlier with the emphasis on it's not a matter of maybe not always having those skills, but just building upon them. But as I mentioned, it's skills like monitoring and reporting for that early warning to early action, the facilitation skills, the networking, the communication. It all is just building upon that foundational knowledge of maybe common legal frameworks or terms that are used. And then what we have are CSOs who then I want to say, speak the language of both communities and the security sector, because the security sector does have, a language or a specific way that they speak in the terms they use. So even as simple as bridging that kind of gap to then have them co-facilitate the community dialogues and be able to, speak to both sides was really important. And then, sorry, I see the other questions too, so maybe I can touch on them because I see that they're directed at me. But the sustainable strategies
Yes, please.
prevent recruitment have you identified? I mentioned in the slide that a very simple one through this process was that a community found that the verification of birth age at the time of recruitment was not being done consistently or correctly. So it can be as simple as, putting in a practice of, well, how are we verifying birth age? If we look at it from a bigger kind of picture, as I mentioned, the issue of recruitment and use of children is so greatly varied context to context. But when a community can identify the early indicators of recruitment and use, so maybe, we notice that an armed group is hanging around a school, then that can be an indicator that recruitment and use may happen. And then what are the steps that we can follow? Is it a parent watch group that's established? Is it a safe school program for traveling to and from the school? I would encourage, we do have some information on the Dallaire Institute's website about our approach and about early warning to early action, because I don't want to take up all of the time. But that is a really great question.
Yeah.
And
Thank
I
you
appreciate
so
the question.
Yes, Anastasiya, thank you so much. That's interesting. And yes, you mentioned that how we can keep the language that can be in both sides, how we can have the language of the community and and the language of the security actors. And we have another question if one of our panelists can jump in and answer. There is a curiosity about shifting power versus shifting risk to the community, as was the references in the last donor session. So do you think the community is ready to shift power to that? And what do you think?
Maybe I can start and whoever can jump in after, but
yes, please.
This is a very good question, a question that as an organization we have been talking about in great length, because when you do work with civil society organizations and indirectly with communities, that do no harm aspect is so important. So as an organization, we have to put in place the do no harm kind of approach for every step of working with civil society organizations and with communities. So that starts from, how we initially engage and identify which CSOs we're interacting with. We don't want to overburden them with, activities and dialogues and meetings when they are already, working in conflict zones and having their own work to do. So it comes from, one, the modeling of the actual approach, two, making sure that everyone is on the same page of what this model and this practice is going to look like at every step. And three, making sure that they have those safe outlets of, if there are security, risks, those are identified ahead of time, those are communicated, and the right mitigation strategies are put in place. And then at the end of the day, the do no harm approach is that as an organization, we are not putting a civil society organization at harm through our activities. And that's something that is, at the center of our work. So it's a very good question. There's a lot of factors that go into it, and it really has to be one, done with the organizations we're working with, and 2, at every step of the process. And maybe someone else can talk about their approach.
Great, Anna. Thank you so much, Anna, for this informative, comprehensive answer. Actually, I don't know if any of the other panelists want to jump in. However, we have a lot of question here, so if you can quickly, Alana, if you can add your inputs for this question, please. Yes.
Okay, I'll do it very shortly, and if I jump in over time, please let me know. Flag it. I'm here for you.
Yeah,
Okay,
sure.
so I would say also like from like the research, it was really a breath fresh air for us and for the local practitioners because they really felt engaged and they really felt that their answers and what they're talking about is really taking into consideration. They were also very comfortable because we told them that you can like say your name or not. If you can see even one of the quotes, we just said like a B. We didn't even mention the name. So they were very comfortable and it was a fresh of breath air for them and for us. And even now, like shifting the powers, like people, as Anastasia said, like they know the context, they are their children and they are the people of the community. They also have their own ideas that they really is beneficial. I hope I didn't talk too much and that's it. Thank you.
Thank you so much, Lana. I think the last question was asked today because we are running out of time. How do you see this power shifting to the local community with the funding difficulties? I think it's an important question because all of us are now facing challenging in the funding. So if any of you can just jump into this question and highlight from your experiences how funding can affect or how you can work within these challenging funding opportunities.
So the funding difficulties, I think, as you said, like all of us are facing in different levels. We're suffering from it, other organizations, all of us. Like really having the localization does really help. We are also exploring new ideas, new things, but sometimes people even have to wear different hats, I would say, even us or on the ground in the field just to cover for this. But I would really say like the partnerships, the localization really helps through this. And also maybe we're also looking at having like more duration of the project, but it's not really in our hands, I would say.
Mm-hmm. Yeah, yes, exactly. Yeah. Yes, all of us, as you mentioned, we are following and you are facing this challenge. However, we need to see and how we can assess our resources and how we can use it to shift power to the communities. Thank you, all of you, for this thoughtful question and reflections. What a rich and energizing discussion. As we begin to close, let's take a moment to reflect what we are walking away. We have asked our panelists to share one key takeaways, each something they helpful. So I will leave the floor to Dom to share these key takeaways.
Yeah, thank you all. This has been an incredible conversation. Thank you also for the questions. So definitely we take away a lot from our three panelists. So I would like to publicly thank Lana because for the experience on engaging local practitioners in the research, in program and policy development through the community advisory board. This increase opportunity for practitioners to take ownership of knowledge development and learning. At the same time, Anastasiya presented us how the community group must be recognized as an active participant in addressing conflicts rather than be viewed as a passive recipients of security measures. And the work of Oricia and her team definitely presented us how the refugee young women leaders and the women-led refugee youth-led organizations, especially those with lived experience of GBV, are definitely unique, able to connect and empathize with adolescent girls, including those who have experienced GBV, but also I would say other vulnerable groups like child mothers, LGBTQI individuals, and people living with disabilities. So I really thank you all for these amazing presentations. Thank you, Lana. Thank you, Anastasia. Thank you, Risha. Definitely thank you, Pasant Ali, for the amazing sessions and the lovely questions that have been coming from the participants. And I would say I set you free for 15 minutes of break before the next session of these annual meetings. Thank you, Kira, for supporting us for the producing, and Manami and Pedro. Thank you all.